Are you struggling with wrist pain and not sure if you need an X-ray, MRI, or ultrasound? Choosing the right imaging can make all the difference in diagnosing and treating your pain effectively. Stick around to learn which option is best for you. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Wrist pain is a common problem affecting everyone from athletes to office workers to older adults. Whether it's due to an injury, arthritis, or repetitive strain, getting the right imaging test is crucial for an accurate diagnosis. But with multiple options like X-ray, MRI, and ultrasound, how do you know which one is best? In this video, I'll break down how each imaging test works, when it's useful, and what you can expect. By the end, you'll have a clear understanding of which test might be right for you or your loved one. So why does imaging matter when it comes to wrist pain? The wrist is a complex joint made up of multiple small bones, ligaments, tendons, and nerves. Because of this complexity, pinpointing the exact cause of pain can be challenging. Imaging plays a critical role in diagnosing conditions like fractures and bone injuries, ligament or tendon tears, arthritis and inflammation, nerve compression syndromes like carpal tunnel syndrome. Different imaging tests provide different types of information. Choosing the wrong test may lead to unnecessary costs, delays in diagnosis, and even ineffective treatments. X-rays. X-rays use radiation to create images of bones. They are quick, widely available, and inexpensive. They are best for detecting fractures or broken bones, identifying joint arthritis or bone spurs, and checking for bone alignment issues. So when is X-ray not enough? It does not show soft tissues like ligaments, tendons, or nerves. Early arthritis or sole fractures may not always be visible on X-ray. For example, if you fall on your wrist and it's swollen and painful, an X-ray is usually the first step to check for fractures. MRI. What does it do? MRI, or magnetic resonance imaging, uses strong magnets to create highly detailed images of bones, ligaments, tendons, and nerves. It's best for diagnosing ligament or tendon injuries, detecting early stage arthritis or bone bruises, and evaluating nerve issues such as carpal tunnel syndrome. The downsides of MRI is that it's much more expensive and time-consuming than an X-ray. It is not always necessary for minor wrist injuries either. So an example would be if you have wrist pain that's been lasting for months with no clear cause, an MRI can help uncover hidden issues such as ligament damage or early arthritis. Next, we've got diagnostic musculoskeletal ultrasound. This is my preferred and more favorable option because I feel like it fits in a lot of different ways. So ultrasound uses sound waves to create moving images of soft tissues in real time. It's safe, painless, and does not use radiation. It's best for evaluating tendinitis and ligament injuries, detecting fluid buildup such as inflammation or cysts, and it's great for dynamic imaging such as watching tendons and ligaments move as you flex your wrist. It's also great for looking for nerve compression syndrome such as carpal tunnel, where you can actually see in real time if there's compression of the nerve at your wrist. So when would ultrasound not be enough? It does not show bones as clearly as X-rays, and it's operator dependent, meaning the quality depends on the skill of the person performing the test. If you have a skilled person doing the test, then this can be a very useful modality in the office. An example would be if you suspect tendinitis from repetitive strain like typing or sports. An ultrasound can assess tendon movement in real time and very quickly help make a diagnosis for you. So how do you choose the right imaging for your wrist pain? Here's a simple guide to help you decide. If you have a sudden injury, such as a fall or trauma, start with an X-ray to rule out a fracture. If you have chronic or unexplained wrist pain going on for some time, consider an ultrasound or an MRI for a detailed soft tissue evaluation. If you suspect tendinitis or chronic joint inflammation, ultrasound is a very quick and effective option as well. Or if you want to evaluate for inflammatory arthritis, such as rheumatoid arthritis, gout, psoriatic arthritis, you can use ultrasound preferentially. Also, MRI can be very helpful here as well. Of course, in the end, the best approach is to consult with a medical professional who can assess your symptoms and guide you to the right test. Some key takeaways here. X-rays are best for fractures and arthritis. MRIs provide detailed images of soft tissues and are useful for chronic or unexplained pain. Ultrasound is great for real-time tendon and ligament evaluation and for looking at inflammation and nerves. The right test depends on your specific symptoms and medical history. If you're dealing with wrist pain, don't ignore it. The right diagnosis can help you get the best treatment and avoid long-term issues. If you found this helpful, make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. If you're dealing with wrist pain and want a personalized evaluation, feel free to reach out. I'd be happy to help. See you next time, and live well.